distancing. Every business premise must determine the maximum number of staff and customers permitted at any one time based on the social distancing guidelines and may not exceed that limit. Coming to curfew. The nationwide curfew will be extended from 9 p.m. to 6 a.m. Apart from permitted workers and for medical and security emergencies, nobody, and that means nobody, is allowed outside their place of residence during curfew. Non-essential establishments, including shops, restaurants, bars, and all cultural venues, must close at 8 p.m. The lists of these establishments will be released shortly. We now know that the simplest and most effective way to reduce transmission of the coronavirus is to wear a cloth mask that covers the nose and the mouth whenever in public. Until now, the owners and managers of shops and public buildings, employers and operators of public transport have had a legal responsibility to ensure that everyone entering their premises or vehicle is wearing a mask. But given the grave danger our country now faces, the adjusted Level 3 regulations will make every individual, meaning everyone, responsible legally for wearing a mask in public. From now on, it is compulsory for every person to wear a mask in a public space. A person who does not wear a mask covering over their nose and mouth in a public place will be committing an offense. A person who does not wear a mask could be arrested and prosecuted. On conviction, they will be liable to a fine or to imprisonment for a period not exceeding 6 months, or both a fine and imprisonment. I must admit that this is a drastic measure, but it is now necessary to ensure compliance with the most basic of preventative measures. We remain particularly concerned about the elderly and those with comorbidities, that is, with other ailments, and ask that they do their utmost to protect themselves from the virus, especially minimizing their contact with other people. One of the more difficult areas of regulation relates to the sale of alcohol. The liquor industry is a major employer and an important contributor to our economy. Our priority at this time, however, must be to save lives. Reckless behavior due to alcohol intoxication has contributed to increased transmission. Alcohol-related accidents and violence are putting pressure on our hospital emergency units. As we head to in the early days of the lockdown, we now have to flatten the curve to protect the capacity of our healthcare system, to enable it to respond effectively to this new wave of infections.